Oh, hello. Hi, Mr. Doe. How are you? That's fantastic. First off, I want to say congratulations. This is your discharge day. Yay! Before you leave, I want to discuss some of your medications with you. Is that okay? Okay, great. So let's start with a good friend, Mr. Tylenol, for pain remover. And basically, it's recommended you only take 2 of these pills every 4 to 6 hours as needed. And each pill is 325 milligrams. Keep that in mind. Um, so basically, if you do any more than the recommended dose, that could cause a lot of problems leading up to even liver failure, which isn't good. And it cause headaches, dizziness, um, a lot of problems. So be on guard and stick with what is ordered by the doctor. Next, we have Lisinopril. It deals with lowering the blood pressure. And it basically tells the receptors in the blood vessels to say, hey, open sesame. It helps dilate the blood vessels so blood can easily push through and lower your blood pressure, which is really important because if your blood pressure goes too high, that can lead to a lot of problems, including a heart attack or stroke, and that's not good. So it's 20 milligrams, and with that, take it every day at the same time every day, preferably in the morning, because that's when early in the day is when your blood pressure is normally at its highest. So you'll start feeling the effects of this drug after a couple of days. Very, very common for coughing. Usually, in most cases, after a couple of days, the side effect do subside and you kind of become accustomed to it. And that side effect wears off, but some people it does not. Now, let's go to metformin. Now, metformin is an anti-diabetic drug. How does it work? Basically, with metformin, which is 500 milligrams, you're taking it in the morning and with evening meal. You always take it with food. If not, it will cause a lot of cramps and gas and bloating, and it's a really messy and uncomfortable situation. And it basically contacts the liver and says, hey, can you not release so much sugar? Because your liver naturally produces sugar to help with blood levels and whatnot, sugar levels. So it basically tells the liver, hey, can you calm down a little bit so we can figure out what's going on? So it lowers the blood sugar level. Also communicates with insulin and works with insulin to become more efficient in what it needs to do in order to regulate blood sugar. And also with this medication, you might lose some weight. And last but certainly not the least is your albuterol inhaler. Okay? It basically is telling the bronchioles, or if you will, the airways to, hey, open up for me so I can get some air through. So this can be taken every 4 to 6 hours as needed. Try not to do any more than that, because if you do, it can cause a lot of chest pain, fatigue, and a lot of extra problems which aren't that fun to deal with. And now I'm going to show you how to properly use your albuterol inhaler. Okay? It's very simple, and with a little bit of practice, you'll get it with ease. First off, you want to shake your inhaler. Basically mix up the medication, because sometimes if you don't, it could cause a lot of the medication to kind of stay in one place, if that makes sense, instead of going in its full capacity to where it needs to go. So yeah, do that ahead. And then you're going to do a first inhale and then exhale out all the way. And then when you start to inhale next, you press down the canister and then inhale the medication. And then you want to hold your breath for about 5 to 10 seconds. That's to make sure that the medication goes into your trachea, down into your lungs effectively. You're taking 2 puffs. So you're doing the same thing again. And basically taking 2 puffs helps push the medicine down more effectively and make sure that you actually are getting treatment into to your lungs. And most inhalers, I like to rinse my mouth out because some medication stays in your mouth, and after a while you can get like a thing called um, lush gush. It's just basically like it could build up bacteria in your mouth and kind of cause a mini yeast infection, which is pretty nasty. So it's good to rinse out your mouth with water or even mouthwash or whatever it may be. Um, so yeah, take that as needed 4 to 6 times a day. And with any of these medications, if you feel at any time after a certain period of time that they're not doing what they're supposed to be doing, contact your doctor. Do you have any questions? That's a real good question. And when Dr. Warren comes in a minute to talk to you, that's actually a really great question. There are other forms of blood pressure medication you can take, such as losartan, um, metoprolol, and whatnot, which she'll discuss what's the best option for you. Um, Lisinopril is known for that side effect of coughing, and that could affect your asthma. So that's one thing to discuss with Dr. Warren to see which think's the best. Yes, and that's an option you can bring up. Hey, what about these choices? That's a really great question. Any others? Great question. Well, it's important to store these medications in a place where you know where they are, and where you have good access to. Especially the two PRN meds, Tylenol and your albuterol. I personally, and this is just the way I was brought up, I personally like to put Tylenol in places where I'm at the most. Like I have a bottle at home, and I also have one in my car because I travel a lot and whatnot. But that depends on you, what you feel is best. And with this inhaler, I highly recommend do not place it in your, do not leave it, well, you can have it in your car, but don't leave it out in the car, especially with summer coming up, because all the heat and the medication and the kind of container it's in, if it gets overheated, it can explode. And so that's not good. So you might need to basically carry it inside of your door when you go in somewhere, take it with you, and just keep an eye on it, okay? Well, if there are no further questions for me, Dr. Warren will be here shortly, and the stuff we discussed, feel free to bring up to her. And you have your paperwork, and just take care of yourself, okay? And feel free to contact us anytime. All right, bye bye.